Welcome to Newcastle Family History Society podcasts. The Newcastle Family History Society, located on Awabakal land in Newcastle, New South Wales, Australia, provides support for those interested in family history. Welcome to How It Was, a brand new podcast series where we explore the fascinating history of medicine through personal stories and lived experiences. Imagine a world where antibiotics were just a dream, vaccines were few, and surgeries were done on dining room tables. Our presenter today and long-time Newcastle Family History Society member, Dr Pamela Harrison, OAM, takes us back to the 1930s and 1940s, a time of monumental challenges and medical breakthroughs. From surviving the pre-antibiotic era to witnessing the birth of life-saving vaccines, Pam shares vivid personal accounts of her childhood growing up in Newcastle. So whether you're a history buff, a medical professional, or someone who loves hearing stories of how far we've come, this episode is for you.
One of the rewards of living a long life is that one can appreciate the advances that have been made in medicine during that time, and in my case, to have not only benefited from them, but to have been a participant in some of them. I was born in the 1930s in Fettercan Private Hospital in Lindsay Street, Hamilton, the old family home of the Gow family. Nurse Townsend was the midwife and Dr Eric H. White was our family doctor. Most babies were born in private hospitals at that time, as midwifery did not start at the Newcastle Mater Misericordiae Hospital until 1941, and not until 1951 at the Royal Newcastle Hospital. Ultrasound had not been invented then, and I defied the skills of the midwife as I was the undetected second twin, born half an hour after my sister, a surprise to all concerned. My father made telephone calls to his three sister-in-laws with the news. He was known to enjoy a joke and had trouble convincing them that I had really arrived. However, once convinced, they rallied to the cause and embarked on duplicating the knitted garments already delivered for the first arrival. During our childhood, infection was still a leading cause of death. My mother did her best to protect her children in those pre-antibiotic days. Her mother had died from septicemia in 1917 at the age of 42, leaving 4 daughters, my mother being the eldest, aged 13. The blood poisoning was caused by an infected pimple above her upper lip. My mother had vivid memories of her beautiful mother covered in purple spots. These were caused by bleeding into the skin as a result of the infection, though my mother always believed it was dye from the purple hat veil her mother had been wearing when she developed the infection. In 1971, while having lunch with 3 other women, I discovered that 3 of the 4 of us had lost a mother or grandmother from septicemia before antibiotics were available. My eldest brother Graham was born in 1928, the first of 5 children. At that time, the diphtheria vaccine was the only vaccine available for childhood infections. He caught whooping cough as an infant, a very distressing and potentially fatal disease, and Mother made sure all her children received vaccinations as soon as they became available over the following years. Tetanus was a feared disease. Horses still pulled the garbage, greengrocer and baker's carts in Newcastle, and like our neighbours, we were quick to scoop up precious manure for the garden. Horse manure is a source of tetanus bacteria. I don't remember tetanus toxoid being available until the 1950s, so any rose thorn prick or deep wound resulting from, say, standing on a nail meant a trip to casualty to get an injection of tetanus antitoxin, which acted against the toxin produced by the infection but did not give long-term immunity as does the current tetanus toxoid. When the boy next door contracted infantile paralysis, poliomyelitis or polio, during the epidemic in the 1950s, my mother was very anxious about our welfare. We didn't know at that time that in 1935 her 15-month-old nephew had died of gastroenteritis while in hospital, recovering from polio, which had left his legs paralysed. Fortunately, our neighbour made a good recovery, but many were left with paralysed limbs and some required artificial lung machines, or iron lungs, to keep them alive. The newsreels at the local cinemas, there was no television, showed what an awful experience this was for the patient. I was horrified at the thought of being encased in that box-like contraption and was relieved when the Salk vaccine became available in 1956. Every child expected to catch chicken pox and measles. We suffered without complications, but in 1951, the girl next door, on the opposite side to the family with polio, who was a trainee nurse at the Royal Newcastle Hospital, died from complications of measles. 3 years later, her mother died from cancer. I dreaded going to bed at night as I could hear her moaning continuously from pain. I would hear the footsteps of the district nurse coming to the house in the evening to give her an injection. There would be silence for a while, and then it would start again. Tuberculosis, or TB, was still a major killer in Australia in my childhood. One of the boys in our street used crutches as a result of TB infection in a hip. I think his mother died of TB of the lungs. From 1948 to 1976, the federal government conducted a successful Australia-wide campaign to reduce the prevalence of the disease using compulsory chest X-ray screening. Sufferers were treated with the newly discovered antibiotic streptomycin and supported financially for the long-term treatment they required. Fines were also introduced for spitting in public places, as the sputum from TB sufferers is a source of transmission of the infection. I still shudder to see children copying their sporting heroes spitting during play. In the 1950s, the BCG vaccine was launched to protect against TB and was administered to all pupils attending school, including the Harrison children. The development of antibiotics was still in its infancy. My mother had surgery in the early 1950s and received a course of the new agent to treat infection, penicillin. This came as an oily substance administered by injection through large bore needles, a very painful procedure. Our cuts were treated with iodine to prevent infection, and if infection did occur, the wound was bathed in hot, salty water or applied with antiphlogiston or a poultice. The aim was to draw out the pus. Sulphur tablets were used for a severe infection such as tonsillitis and came as large tablets with a nasty taste and were difficult for a child to swallow. Most children had their adenoids and tonsils removed routinely, as with no antibiotics, tonsillitis from a streptococcal infection could cause rheumatic fever, which could damage the heart or heart valves. The infection could also cause scarlet fever or kidney problems. I remember being told that in the 1930s, Graham had his tonsils removed at home on the dining room table. Usually the kitchen table was used, but our kitchen was too small to have a table. The rest of the children had their operation in hospital. My twin sister and I were turning 9 when we had our surgery at the Mater, when ether was used as an anaesthetic. There was no sedation beforehand, and I still remember the awful sensation as the ether was stripped onto the gauze mask over my face each time I breathed, and the sensation of large balls rolling in my head and the terrible nightmares of drowning I suffered for years afterwards. Our beds were in the veranda section of the children's ward, and as evening came, swarms of mosquitoes, the Hexham greys, from the nearby Hexham swamps would invade the ward. All the hospital beds had a fixture attached to the back of the bed, allowing a large mosquito net to be draped over the bed at night to protect the patient. Sometimes the mosquitoes were trapped inside the net. I remember our mother being with us that first evening when I started to vomit blood, and she quickly called for help. I don't remember what happened next, but apparently I was taken back to the operating theatre and the bleeding was stopped. All the surgery was performed by the family doctor. We were children during the Second World War and saw many ex-servicemen with missing limbs. In contrast, it was unusual to see physically or mentally disabled children or adults, as it was the custom to confine them in institutions, mostly at the time of diagnosis. Occasionally mothers defied the pressure to be separated from their child, and I remember occasionally sighting a little old lady pushing an enormous old wheelchair along our street. In it was strapped her middle-aged daughter dressed as a little girl. I think the daughter may have had cerebral palsy. Mother used to say that as Graham was her first child, he was her learning experience, and the later children benefited from her mistakes. Graham was born with auburn hair, a redhead, a surprise as redheads were uncommon and my parents and our relatives had black hair. This is because hair colouring depends on two genes and the one for black hair is the dominant one. It meant that both our parents carried one gene for black hair and one for red hair, and Graham had inherited the two red hair genes. Consequently, our mother did not know that redheads did not develop a tan in the sun, but would get sunburned. She was devastated when, after exposing Graham to the sun, as was the custom at the time to prevent rickets, he suffered severe sunburn and blisters. My sister and I benefited from this mistake, but we did not always appreciate it at the time. We too had auburn hair, while our other brother and sister had black hair. Sunscreen had not been invented, and sun lotions were supposed to help protect from sunburn, but being oil-based, they only made it worse. Mother was ahead of her time, as while there was no sunscreen to slop on, she made sure we slipped on a blouse and slapped on a hat when we went out in the sun, even when wearing a swimming costume. When we forgot or disobeyed, we paid the price, suffering severe sunburn and sometimes blisters, even on the tops of our feet when wearing sandals. The pain was best soothed by our mother gently rubbing the area with the cut surface of a tomato. Career options for women were few when I sat the leaving certificate in 1953, and even more limited for those living outside Sydney. I had hoped to study science, but there was no university in Newcastle, and although Commonwealth scholarships covered university fees, they did not cover boarding in Sydney. Fortunately, a family friend who had kidney disease told me about her visits to Royal Newcastle Hospital for blood tests, which were performed in a department called pathology. My father was a supporter of education for women, and he investigated the possibility of my working in pathology at Royal Newcastle Hospital. It was a great disappointment to find that although one could train as a pathology technician in Newcastle, Dr Douglas, the director of pathology at the Royal, had stopped employing trainees and would only accept science graduates. The future looked bleak, as the only professions available for women were teaching, nursing or secretarial work, none of which appealed to me. My world changed a few weeks later when an advertisement appeared in the Newcastle Morning Herald on the 30th of January 1954. It was for a trainee pathology technician at the Mater Hospital, Waratah, and I was the successful applicant. I was about to enter what I regard, as did many of my colleagues, the golden years of medicine, during which significant discoveries were made which dramatically improved not only the medical and surgical diagnosis and treatment of patients, but their terminal care.
Thank you for joining us on this episode of How It Was, and thank you, Pam, for sharing your childhood experiences with us. In our next episode, Pam will tell how she embarked on her career in pathology, describing some of the methods and equipment of the early days, including using cane toads to test for pregnancy. If you enjoyed this episode, why not share it with others? And don't forget to follow us on Newcastle Family History Society podcasts.